Officials nationwide are bracing for a swine flu pandemic. KXLY4's Erik Loney is live with Spokane Regional Health Officer with what you should do if one of your loved one gets the flu this year. Erik?
Yeah, good morning. Joined now with Dr. Joel McCullough. He's the health officer for the Spokane Regional Health District. And Doctor, we've been talking all morning about the swine flu. What are some of the symptoms of swine flu and just regular flu? What type of things will people be feeling?
Well, the symptoms of the swine flu and the regular seasonal flu are about the same. Most people feel a fever, a sore throat, cough, body aches, headaches, feeling tired, those type of symptoms.
So no difference between swine flu and the other?
No, you really can't tell the difference between the swine flu and the seasonal flu in terms of symptoms.
Should people be going to the doctor sooner this year if they feel those symptoms?
Well, most people with the flu, swine flu and regular seasonal flu, they get better on their own. So there's no need to go to the doctor just to find out which type of flu you have. For most people, staying home, drinking plenty of fluids, getting plenty of rest, they'll get better in about a week or so. But for those with the possibility of complications, with an increased risk of complications, such as young children, the elderly have increased risk for the seasonal flu, for example. People with chronic medical conditions, they should seek medical attention sooner, because there are treatments for those type of people who are at risk for increased complications.
And one, I think, important clarification is that if you get the swine flu or if you've been diagnosed, it's not a death sentence.
Swine flu is like the regular flu. Most people get better in about a week or so, and then they go on with their lives. So it's pretty similar to the regular seasonal flu.
And the best thing people can do, wash their hands, also get vaccinated.
The best prevention for swine flu and regular seasonal flu is to get the vaccine. We also want to make sure people know that if they do get sick with flu-like symptoms, they should stay home and avoid spreading it to others. And of course, washing your hands to make sure that you get the germs off your hands. And if you cough or sneeze, cover your cough with tissue or your sleeve.
Okay. And as far as getting more information out to people as soon as you get it, there's still a lot of unknowns. What are you guys doing?
We're still updating our information, and if people want more information about the swine flu, they can go to our website, which is www.srhd.org.
Okay. All right, Dr. Joe McCullough. Next at 7:25, we're also going to talk about more about the swine flu and more about what the health district is doing to prepare this region. Reporting live, Erik Loney, KXLY4 HD News.
Hey, Erik, quick question. We'll get to him at 7. You there, Erik? I was going to ask you, how closely are they working with our Eastern Washington school districts in terms of a plan in place in case a breakout, happens in one of the schools?
Okay, I'll ask Dr. McCullough, what are you doing? You've been working with the health districts. What's the plan with the health district and school districts if there's an outbreak in a school?
We've been working with the school districts very closely. We're having a planning meeting today with the school districts. We're working with them to have a better sense of their absentee records, to see how often children are calling in because they're sick, and specifically whether it's with flu-like symptoms or not. So we're working with them to get more real-time, better information to see whether school closures are necessary or not. Okay.
And that will be something that will be determined whether the health district needs to call for a closure or the district themselves call for it.
For public health reasons, the health district will call for closures. That'll be based on information that we're receiving from the school, and it will also depend on severity changes in terms of how serious the virus. If the virus changed to a more serious form or not.
Okay. All right, Dr. McCullough, thank you. They're on it, and it's a lot more. This is still kind of working through the process.
Yeah, a lot involved in that. Thanks for that update, Erik.